Hi, and welcome to my discussion on collagen. A couple weeks ago, I had a live session to where I was testing out a device that is supposed to tone and strengthen the abdomen. Well, in that discussion, we talked about collagen as something that can help the skin repair itself and help muscles and things repair itself. And we often get asked about collagen here in the clinic. Is it something I should do, something I should not do? So I thought it would be a great idea to take some time and discuss what is it, why would I take it, what do I need to consider when taking collagen. All these things are important. So let's start with the question of, do you have a problem with collagen? Because honestly, if you don't have a problem with collagen, maybe you don't need to take it. What would make you think you might have a problem with collagen? Let's go over some signs and symptoms. So skin that wrinkles or becomes kind of crepey, so it looks kind of, crepey, like crepe paper, or the skin is just sagging, that can be a sign of low collagen. If you notice hollowing out of the face, particularly around the eyes, then you could have a collagen issue. If you feel like your muscles are shrinking or becoming weaker, that can be a sign of low collagen. If you're becoming stiffer and less flexible, if you're noticing joint pain or feel like you're getting more arthritis, loss of mobility in those joints, so maybe you don't have pain in the joints, but you're just not feeling as mobile in them. Gastrointestinal problems like leaky gut, if you've ever heard of that. So a lot of gas, bloating, especially after eating, and then starting to feel lethargic and bad after eating. Those could be signs of lack of collagen. And also problems with blood flows. If you feel like you have poor circulation, it could be that there's damage in the blood vessels and you have a lack of collagen. What exactly is collagen? It's a protein, and it is the most abundant protein inside of the body. It's present mainly in our connective tissues of things like our skin, our hair, our bones, our ligaments, tendons, muscles, cartilage, and inside the blood vessels, particularly the walls of the blood vessel. What does collagen do for us? It helps to clear and replace damaged cells, specifically the skin, damaged skin cells. So it helps to clear those and replaces them with good, healthy cells. It also provides a protective coating for our organs, so the organs of like the liver and the intestines, and it helps to be that protective coating for those. It aids in repair of those blood vessels, so if there's been damage inside the blood vessels, or if you have problems clotting, collagen can be part of that. One of its big ones is that it gives structure, strength, and elasticity to the skin, so it's what helps us keep our youthful appearance. Why should you consider supplementing it? Well, our collagen actually starts decreasing, our collagen production rather, starts decreasing in our 20s, early 20s. By the age of 40, collagen production is down by 1% a year, and it keeps going at that rate. So every year after 40, down by 1% a year. And by the age of 80, you're only at about a 75 production rate of your collagen that you were in your early 20s. Most of us, and why this is important in weight loss, why we're even having this discussion about collagen, we've gained weight and we've deflated our body, and when we deflate our body, that skin is kind of saggy and it doesn't look as youthful and as pretty as we once wanted it to. So we've stretched out our skin and we're after 20, so we're losing production. That might be a reason of why we should consider if it helps with the strength and structure of the skin and elasticity, as we're trying to encourage our skin to go back to how it was. Now, there are other things other than aging that can impair your ability to produce adequate collagen, and I think they need to be addressed before you even consider a supplement. The first one is excess sun exposure. So I'm not scared of the sun. I think we all need sun. We need it for that important hormone called vitamin D. Yes, vitamin D is a hormone, not necessarily a vitamin, but we need that. But there's a difference between sun exposure and excessive sun exposure. We don't want to have leather skin. So excessive sun exposure increases the breakdown of collagen. Smoking decreases the production of collagen. So if you're out in the sun a lot and you're smoking, two bad things. Alcohol consumption and a poor diet, specifically a diet that is high in sugar and refined carbohydrates. So can you say maybe need a low carb diet there? But so diets that are high in sugar, high in processed carbohydrates, and also alcohol consumption, it creates a process called oxidative stress, or creates oxidative stress in the body. When I think of oxidative stress, I think of like rust. So when a metal is rusting and it starts in one place and then it spreads to the next, and before you know it, you've got a hole in that piece of metal. Well, I think of oxidative stress similar in the body. So basically, when you eat that sugar or that refined carbohydrate, or you're drinking that alcohol, that sugar from that attaches to a protein in the body and forms a molecule. That molecule then affects the proteins around it and causes damage, and it causes the collagen in that protein to become weak and brittle, so it breaks down more, increasing that aging look to the skin. So emotional stress also causes the breakdown of collagen. And if you've ever heard of the idea that emotional stress ages you, or a stressful event ages you, it's totally true. So when you're stressed emotionally, your body produces more cortisol. Well, there's that downstream effect that causes weight gain during that, but cortisol directly decreases the production of cortisol, or directly decreases the production of collagen, and increases the breakdown. So you're making less and breaking down faster. So it literally ages you faster. Stress does. The hormonal changes of pregnancy and menopause also trigger a higher production or higher breakdown of collagen. And then there's also some genetic conditions like Ehlers-Danlos. They're rare, but they happen, and they do affect collagen and cause a breakdown quicker. Where do you get collagen from? Well, your body makes most of the collagen that you have, but it is naturally found in animal-based foods. Plants do not have collagen. They can contain nutrients that help your body make its own collagen better, but plants do not contain collagen. Only animal source foods contain collagen and all the nutrients that you need to make your own collagen within your body. So to make collagen in your body, what do you need? Let's talk about that too. You need amino acids. So amino acids are the building block. Think of it as your backbone, your building block of everything else. The only complete source of amino acids comes from animal-based foods. The reason I mention that is because if you're a plant-based person, if you have more plant-based slant to your diet, you have to eat a very wide variety of foods in order to get all of the building blocks that you need, because you can't get them out of a single source food as you could if you were to, say, just have a steak. You're going to get all of those amino acids complete without any supplementation. The next building blocks are things like vitamin C, copper, zinc, vitamin A, vitamin E. And many people think you can only get these vitamins or get all of these vitamins if you're including plants in your diet. I'm bringing this up because this is National Carnivore Month. Actually, it's the last day of National Carnivore Month, which is where people are encouraged to try a carnivore type approach and see what it does for their body and their health and that type of things. But there's this idea that you have to have plants or fruits and vegetables or you're not going to get all your vitamins, and that's just a falsehood. There's no proof in the literature that you are going to become deficient if you are living off a predominantly animal-based diet, and your animal-based diet actually has the completes of all of those. Now, it is true that some plants and fruits, vegetables carry more of those vitamins and minerals than in some of your meat sources. However, plant sources also have these things called phytotoxins, and phytotoxins will actually block you from absorbing all of these things. So you don't need as much in the animal-based product because you're going to absorb more from what you ate. So the complete amount of amino acids and vitamins and things that you need is mainly found in animal-based sources to create your collagen. Now, there are 28 different types of collagen in the body, but the most common are types 1 through 4. And this is information you'll need if you're looking at a supplement to determine if this is one that's good for you. So type 1 is the most common version of collagen in the body. It is the one that gives our skin its structure, our bones strength, tendons and ligaments, that structure. So type 1 is the most predominant, one of the most important. Type 2 is found in the elastic cartilage, and it provides support for your joints. So if you're someone who's got really lax joints and you're wanting support, you might want to include a type 2 collagen in your diet. Type 3 is found in the muscles, arteries, and organs. So if you're more interested in muscle health and helping your arteries and protecting your organs, type 3 is an important one. Type 4 is found in the layers of your skin. So you have multiple layers of your skin. It's found in all of those layers, helps to connect them together. And then type 5 is actually found in your cornea of your eyes. It's also in your skin, in your hair, and it's in the tissue of this placenta of a pregnant woman. So that was types 1 through 5. The most common ones are type 1 and 3 in supplements that are out there. If you're looking for anti-aging and just looking for skin, you definitely want type 1. If you're looking for more muscles, you want more like a type 2, type 3. So let's keep going. Do collagen supplements actually work? Because, it's all fine and good to know where they come from, to know the best sources, to know how to create them, but if they don't work, what is the point of taking them? So I want to go over some of the main reasons people would take collagen and if there's research that backs it up. Let's start with the skin, and the skin probably has the most research to back up collagen use, and there are multiple studies that show supplementing collagen in the diet helps to improve skin hydration, it decreases wrinkling, it helps with the elasticity or the rebound of the skin, it helps to reduce the size of the skin pores, and overall reduction of skin aging, also speeds wound healing, which is something nice. So yes, there's research out there that shows that collagen supplementation does in fact help the skin. For joint health, there's a meta-analysis, meaning they looked at a whole bunch of different studies, and they found insufficient evidence to show that supplementing collagen actually helped with joint health. There was a randomized control trial, so they had a group of athletes and they split them up, and some of them got the intervention, some of them didn't. One of the very most rigorous scientific type studies. So the randomized control trial of athletes and whether or not supplementing collagen helped to decrease their joint pain, and they did show that it helped to decrease their joint pain. This again was an athlete, so we don't know that we can put it to everybody, it's just to that specific demographic. For bone health, there's been a small study that had women, menopausal women, and they were taking calcium and collagen or just calcium, and those who were taking the calcium and the collagen supplement showed a decrease in the protein that breaks down the bone. So adding the collagen actually could slow down the loss of bone. For weight loss, this is one where collagen has been touted as being very helpful. It's all over the internet as being a reason to take collagen. And honestly, there's very little research out there to support it. And the collagen research that is out there is attached to a company who's trying to sell a collagen supplement, so we don't know how trustworthy some of it is. There is one study, though, that compared collagen to whey protein. And they actually found that whey protein was more favorable than collagen for weight loss. I'm going to come back to that again in just a few minutes and tell you why I think that is the case. But overall, there's not a lot that shows that it hurts, but not a lot that shows that it helps when it comes to weight loss. With GI health, so remember there's a type of collagen that helps to protect the gut, help leaky gut. There's also limited evidence, like scientific evidence, that shows that it helps. There is some scientific evidence that it may reduce mild bloating and mild GI symptoms. However, when people start a collagen supplement, the number one side effect is GI symptoms, so I'm just not so sure about that. What I would say, I'm going to speak from my personal experience inside the clinic now. When people are having GI issues, one of the best versions of collagen is bone broth. It's natural, the body knows what to do with that, it's readily absorbed, and I have seen that help with GI symptoms and leaky gut to repair the gut. So bone broth, if you're having GI issues, is probably something that would be worth a try. For heart health, there is limited evidence. So if you remember, collagen is inside the blood vessels and helps to repair them and repair the damage. But there's limited evidence in the scientific data or scientific research to show that collagen might help with heart health. There was a study done on rabbits, which I found quite interesting that they did a collagen study on rabbits, because if you think about it, eating an animal source is not necessarily the proper diet for a rabbit. The proper diet for a rabbit is more roughage and weeds and lettuce and vegetables and things like that. They don't eat flesh, which is where your collagen comes from. But regardless, in this rabbit study, they showed that there was a decrease in the buildup of plaque in the arterial walls. There was a similar human study that did not show it. So I think it probably has to do with the difference in the genetics between rabbits and humans. So maybe helpful, maybe not helpful, definitely not harmful. Now, remember I mentioned that in weight loss, there was that study that whey protein and collagen and the whey protein outperformed? Well, if you're looking at the protein content of most whey protein supplements and the protein content of most collagen supplements, you're going to get way more protein in the whey protein. No puns intended there. Just you get more protein out of the whey than you do out of a collagen supplement. Much of the research that is out there on collagen doesn't control for the overall baseline protein intake in the diet. So some of these benefits that it's seen for skin, for everything else throughout the research, may actually just be from increased protein in the diet. And if you are a client here at DMA Weight and Wellness, you know that we focus on protein. It's our primary macronutrient that we focus on. And so eating a good protein-rich diet, a good animal-rich diet, gives you a lot of the benefits that the collagen supplementation does, potentially. So if you're going to supplement, what do we do? What do we look for? Where do we go? The first thing I want to say, and I want everyone to hear me loud and clear on this, while we would all love to have an easy fix for our skin to just rebound and go back into place, and we'd love to have an easy fix for weight loss, there is not a single supplement of any kind out there that is going to give you an easy fix for anything. It just is what it is. And that comes to collagen too. We are not going to take collagen and suddenly have the youthful skin that we wanted from 20 years ago. You also cannot expect to take collagen and continue to have a poor diet and have a better outcome for the things you're taking the collagen supplement for. It just doesn't work that way. If you continue to put crap into your life, you're going to get crap out of your life. You continue to smoke and drink excessive amounts of alcohol and lay out in the sun and become a leather-skinned person, you're going to have negative outcomes. So nothing replaces the lifestyle changes that need to happen to make your body create its own natural collagen better. But with that said, collagen supplementation can be helpful. And in my experience here in the clinic, where I've seen it be helpful is when people are having a hard time hitting their protein goals. It definitely helps them reach their protein goals. And I do think it helps with skin elasticity or the rebound. It helps the skin be more moisturized, and it just gives your body an opportunity to maybe heal a little quicker and have a little bit more of that smoother skin, not quite so crepey at the end of your weight loss journey. So to make good collagen, you must eat a nutrient-rich diet, preferably animal-based, but you can also do it plant-based as well. It just must be nutrient-rich. Having a hard time with that word today, rich. Get enough sleep so that you're rested, you're not overproducing cortisol and stress. Don't smoke. Decrease or cut out alcohol, and reduce your environmental and emotional stressors in your life. Those are the things to do. Now, if you're going to supplement, things to consider. It takes 2 to 3 months of supplementing regularly to see an outcome, especially on the skin. So be patient and wait for your outcomes. Also, if you're starting a weight loss journey, I recommend starting collagen at the beginning and taking it the entire time you're going through your weight loss journey to give your skin the best chance at rebounding. You want to choose a collagen that says it's hydrolyzed. If it is not hydrolyzed, it is not in a version that our body can break down and absorb, and you're just going to excrete it, and it did you no good whatsoever. So you want it to be hydrolyzed. You want to look at what types of collagen are in it. Remember, we talked about those 1 through 5 types of collagen, and if skin's your main one, you want to look at like 1, 3, and I believe 5. If muscle's more of what you're after, you want to go with more of like the type 2 and the type 4. You want to also look at added ingredients. We don't want a lot of extra stuff in there. A lot of collagen supplements put soy, dairy, gluten, and all these other fillers in it. So choose a product that has minimal ingredients in it. So what collagen do I use, or what collagen do I recommend for my patients? That might depend on what you can afford, but the collagen I recommend everyone use is bone broth. I love Kettle and Fire. They're one of my favorite brands. I think they have a great taste. My patients also get a discount for that. So look at the top of our Facebook page and use the discount if you're going to use Kettle and Fire. But it's a very natural form of collagen. Our body knows what to do with that. It's not got added ingredients to it. If you don't like drinking bone broth straight, you can cook with it. Any recipe or soup that calls for a broth, you can just substitute bone broth in that. There are a couple other brands that contain all versions of collagen, so 1 through 4 or 1 through 5. The two of those are Skinny Fit Super Youth. So the brand is Skinny Fit and the name is Super Youth. The other one, and I have tried this one and I found it to be quite pleasant, is Ancient Nutrition Multi-Collagen Protein. So that was Skinny Fit Super Youth and Ancient Nutrition Multi-Collagen Protein. I personally have used some from the brand Further Foods and I find it quite yummy. I like their chocolate one. It has minimal ingredients. It's just the cocoa and a little bit of stevia as the sweetener. It also has some adaptogens, like there's a mushroom in it and ashwagandha in it, which can help with stress and things like that, which helps with the cortisol. So Further Foods, it's a very clean one. I've enjoyed using it. It only has type 1 and 3, so it's best for the skin and not for the joints. I've also used Vital Proteins. It is a readily available one. You can find it at sometimes Kroger, Walmart. I know Costco's had it. CVS has had it. You can buy it online on Amazon. They have plain. They have chocolate, which I like to mix with Greek yogurt often and make a chocolate yogurt. It's also my daughter's, one of her favorite breakfasts that she does, and it gets 30 grams of protein if you do a cup of Greek yogurt and 1 scoop of chocolate collagen, so it boosts that protein up quite a bit. The only thing I would say about Vital Proteins is, they're fairly clean, but you don't always know what types of collagen you're getting in it. Yeah, those are the ones that I use. So to recap, nothing beats what you do as far as what you're eating and how you treat your body and working on your stress. You have to do those. If you are going to supplement, use that bone broth from time to time and look for a pretty clean ingredient. Overall, collagen can be helpful, especially for your skin, but don't expect it to be a miracle product. If you have more questions, feel free to put them in the comments and I'll do my best to answer them. Thanks, and I'll see you next time.